Hi, it's me. So I finally took your advice and went to the hospital.
Okay, how'd that go?
No, not good. Took me 13 hours to see someone, and you were right. There's something wrong with me.
So, what's going on?
I don't really know what's going on other than I have an infection that requires me to be back 3 times a day to get IV treatment.
3 times?
Yeah, at 7 a.m., at 3 p.m., and at midnight. And I don't know why they wouldn't just, I don't know, admit me, but they didn't. And so now I get to drive there every day, sick, to get intravenous antibiotics.
That sucks.
Yeah, it does.
Sorry to hear that, baby.
So, anyways, for the next week, you're gonna have to find someone else to take you to work.
Alright, I'll figure it out.
All right, well, I'll talk to you when I get home.
Okay.
Okay, bye.
The person that informed me about Angel Flight was Dr. Pawlowski. We always talked about his family and his kids, except for this one time we talked about Angel Flight.
Angel Flight Alberta is a volunteer pilot organization that provides free air transportation to patients needing to get to and from their medical appointments.
And they're coming largely from northern Alberta or northwest.
Places like Lacrete, for example.
Often their appointment will maybe 20 minutes or so, but they could take up to 3 days. So we will go and pick them up, fly them down to places like Villeneuve, where we have a van that's equipped with stroller, car seats, all that sort of thing. And then we will drive them to their appointment, save them having to find parking. We drop them off for their appointment and then pick them up afterwards. Drive back to the airport, and then we will fly them back home.
It started as a recognition that Albertans are, especially rural Albertans, disadvantaged in that they have a hard time accessing medical care, living at a distance from larger secondary and tertiary care facilities.
After we had that conversation in his office, the next day I was driving alone and I was thinking about how many people that there were out there that avoided their treatments because of personal uncontrolled circumstances.
My work as a physician gave me exposure to that, having family members as well who needed to access that level of care, but living at a distance, found themselves experiencing some degree of hardship.
I have found barriers. I have friends and family, and even myself, who have had to go down to the city for medical appointments that should be taken care of here.
Before we had a new hospital, it was always a problem with the old one.
A lot of people are having to travel to a lot of various locations to receive the help that they need, where they should be able to get it where they are.
Air travel is not cheap, and a lot of people don't have the financial means for air travel. You know, they might have the means to drive from, let's say, Grande Prairie to Edmonton, but to drive, 5 hours for a half-hour appointment, and then to drive back again. If that appointment's at like 8 or 9 in the morning, or maybe 10 in the morning, where you have to either leave the night before and spend a night in a hotel, or leave at the crack of dawn, it's a big imposition. The people that we take on these Angel flights are so darn grateful. You almost want to cry after you've done one of these flights.
I made a flight, took a lady and her daughter down to Edmonton. The daughter was receiving cancer treatments. And I remember when we were just coming back into Grande Prairie, I asked her if she was okay. She said, yeah, it's really good. I just can't believe this normally takes us a couple of days. I'm gonna be at home tonight. You've just bought me some more time.
When you're flying some of the guests that we have, you have to, first of all, be confident in your piloting ability. And second, you have to have people skills.
That's where, you know, when you're with some of these people, they're going through a real trying time in their life.
They're going to medical facilities for a reason.
To be a good listener and to be compassionate to what they're going through is very important.
Basically, we want people to worry less, so they think about what they really need to think about versus trying to get to actual medical facility.
Angel Flight Alberta operates off of donations, which cover the cost of our fuel. It's an example of the support in the Peace Country. They raised $40,000. And then all of our pilots donate their time, their aircraft, and all the maintenance costs.
Sometimes my support is getting the medical field aware of the challenges that these people have. I have had a number of occasions where people were asked to come down for a diagnostic test, and within a week to come back again to review the results of that. And so by getting on the horn and speaking to the physician, I would bring them up to speed on the fact that these people are coming from 11 hours away, and those results of that MRI would be available within minutes to hours. They were able to coordinate both appointments, so the MR would be done and then the visit shortly thereafter to save them that second trip down. Alberta doesn't rank very well. For dollars invested, we don't get the same outcomes as other provinces, and so I think that in part is due to underfunding primary care. I think primary care has been underappreciated, undervalued. I think that family doctors are a huge resource for our population.
With the new facility now, we have that potential. So we could actually be that center and serve the people from further away, people that need medical care.
I think it's mostly the geography. Alberta is just a huge province.
And Grande Prairie is definitely isolated.
I know it's a topical discussion, the healthcare system in our country. Our provincial healthcare model relies upon major treatment centers.
At this point in time, we're unable to justify having specialty and subspecialty services available in all small communities.
Now it is way better. We got a new facility, but it feels like we still don't have enough doctors.
Grande Prairie has a brand new hospital, and sadly, more recently, they've lost some services as opposed to growing the services that they can provide.
In addition to that, it'd be really expensive for the usual medevac providers to provide that service. We fill a bit of a gap at a very economic price point. I mean, it's virtually no cost to whomever, and we just get reimbursed for our fuel.
When people from remote locations are medevaced in, emergently dealt with, discharged, quote unquote, home. But it's just to a curb. They are discharged to the hospital parking lot, and it's left to them to try to find a way home. I think Alberta Health Services could go a long ways to address that deficiency. And we have had some early negotiations or discussions with them, but there's been a lot of resistance and pushback. The way it's working right now doesn't cost them a dime that they know of, but that is actually inaccurate, because often physicians will discharge that patient to their home community, and yet the accepting physician in their home community will not even make a chart for them. They're basically discharged once they hit the hospital front door.
Hi, I'd like to get a squawk code for an Edmonton City tour. Yeah, that's correct. Yeah, the call sign is Charlie Foxtrot Papa Whiskey Papa. The aircraft is a DA-62. That's correct. We'll be departing at 11:30 for half hour.
There's a number of challenges, I think. The price of fuel, price of aircraft, the cost of just maintaining an airplane, whether it's insurance or maintenance. And there's not as many young pilots buying airplanes. It's expensive to get the training and get your private license, somewhere in the order of $20,000. Most of our pilots are visual flight rules only, so they only fly in reference to the ground. They're not instrument rated. It's sometimes difficult to find a pilot on the day that people need to fly. There are definitely weather delays, whether it's fog. With the fires, the smoke, the visibility was down below 3 miles. We also have a challenge with the temperature. Unless you have a high altitude airplane, like a twin engine, it's just not safe to fly anybody below -20.
With the loss of like the Greyhound service, it became more difficult for people to travel. Often, a lot of our flights, we get more requests even in the winter because people are traveling on bad roads.
One of the questions we always ask our passengers have what we call a bingo time. So the last time that we can cancel and they can still make their appointment by road. We're always cognizant of that.
We ask all our passengers to make sure they are actually able to get in a plane. It's not a minivan, it's not that convenient. So we'd ask them to do what's called a bathtub test. So if you can actually unassistedly get into a bathtub and get out, you should be able to climb into a plane.
So as far as safety equipment is concerned, in the passenger seat in the back right-hand corner, there's a knife that you can use. If you can't get your seatbelt off, you can use that to cut your seatbelt. And if you had to poke through these windows to get out of the airplane, if the airplane got twisted in a crash, there's also a fire extinguisher there. And behind the passenger seat, there's a first aid kit. Okay.
Prior to COVID, we had considerable number of flights out of Grande Prairie and the northern Alberta, and even out of places like Calgary to Grande Prairie and vice versa. But once COVID hit, our demand went down considerably. A lot of the appointments were being canceled and specialists weren't taking new people. People weren't going out, or they were doing it virtually.
Number one, we would need to build more awareness with the doctors and with local clinic and any other medical institution, just so that we could get reference from the doctors so that they were aware of the service, that it's available, that they can actually refer their patients to us.
I think that we currently are struggling in attracting primary care physicians to this province due to some recent events, and to see Alberta become a go-to province to attract people, even to fill residency spots that went unfilled for the first time ever, would be a good thing. And to see all Albertans being able to access primary care physicians, I think would be a huge plus. I think we need to create a good working atmosphere for them and have them appreciated for the services that they do provide. And when you've got people that are working in rural settings, in industry in northern Alberta, and can't access medical care in a timely fashion, it's just nice to be able to give back and provide a little bit of relief for Albertans.
I definitely see that we do need to do a bit more for like just general awareness for people. There's definitely way more we can do, and we are trying.
I think that especially now with the dollar crunch, hopefully we're going to be able to put more money towards that to improve outcomes so that we have better metrics.
I definitely see a potential to grow the actual number of requests to transport more passengers, and in that case we definitely will need more pilots.
Right now I'm working with pilot resource management, which includes recruiting pilots, making sure the pilots we have are still active, and keeping the pilot list up to date. It's always a challenge to find pilots.
I see Angel Flight Alberta continuing to be a much needed service, and I do believe as more people learn about us, we will continue to increase the number of flights that we're making and transporting people to these much needed appointments.